animal protein and cholesterol cause heart disease. The higher the blood cholesterol, the higher the risk of heart disease. Heart disease is the most common of the diseases of affluence. It affects 1 in 2 men and 1 in 3 women. It kills 1 in 3 of these people every 30 seconds in the United States alone. Women die 8 times more frequently from heart disease than breast cancer. Yet, most people are more afraid of cancer than this silent and deadly #1 killer. Dr. Ezelstein is a distinguished surgeon with some 40 years of expertise. He conducted the longest study demonstrating beyond any doubt that a pure vegetarian diet with no dairy products or eggs effectively reverses heart disease and stops it from progressing.
We have to appreciate just how much cardiovascular disease has really infiltrated our health situation. We know, for instance, that through the battle casualties that were studied in Korea and in Vietnam, that roughly at an average age of 20, 80% of these young GIs, when their coronary arteries are examined without a microscope, already have gross evidence of the disease. Now, is it therefore any surprise that when somebody like Dr. Lewis Culler, who is a professor of public health at the University of Pittsburgh, has stated that all men by age 65 and women by age 70 who have been exposed to the traditional Western diet have diffuse cardiovascular disease? What does that tell you? Our entire nation, all men and all women, have cardiovascular disease. This is so powerful to get across to the organizations that are providing us with our food and our food guidelines.
Most people think that medication for lowering cholesterol and blood pressure or bypass surgery can cure their problems once they get it. The pain accompanying heart disease is often quite severe and crippling. Bypass surgery and other available procedures are not an effective solution.
In Western medicine, what the profession has to offer is, of course, just drugs, pills, procedures such as stents or bypasses. Now, these procedures have a great deal of risk. It's not well advertised, but of the 1 million people, for instance, who are going to be having a stent this year, 1% are going to die at the time of the stent. 1% of 1 million is 10,000. Now, if we had lost 10,000 GIs in Iraq this year, it would be called carnage. Of those 1 million people who have stents, there are going to be 4% who are going to have a heart attack at the time of the stent. That means 40,000 people at the time they're having a procedure to protect them from having a heart attack are going to sustain a heart attack. Pills and procedures really just don't get it done, because it never addresses the basic causation of the disease itself, which is the toxic Western diet.
Blood cholesterol is the single most crucial factor in determining heart and blood vessel disease. Together with other fats, protein, immune system cells, and other components, cholesterol deposits on the inner walls of arteries. This accumulation eventually leads to blood vessel blockages to the heart. According to the Bogalusa heart study, which appeared in the New England Journal of Medicine, 50% of children 2 to 15 years have fatty streaks, marking the beginning stages of heart disease.